A regular eye exam is important at any age, but when should you start? Optometrist Dr. Avinashi is here with more. Good morning to you.
Good morning. How are you?
Great. So yeah, the eye exams are very, very important. And when it comes to children, when should you take your child to see their first eye doctor to get their first eye exam? When does that happen?
Yeah, the BC Doctors of Optometry, along with the Canadian Doctors of Optometry Association, do encourage parents to bring their kids in for their first visual screening by the age of 6 months old.
Oh, early, very early.
Nice and 6, because there's a critical age of development from 0 to up to the age of 6. But if we can catch things early enough, we can manage it a lot better. And at the age of 6 months, we do very objective testing, very simple testing. We look for milestones that we're meeting with each kid. And we rule out things such as lazy eye or amblyopia.
And how often should people be bringing their child in for an eye exam then?
Typically after 6 months, we recommend this next test to be at the age of 3 years old. Okay. And at that point, we make it fun experience, but we check for things like binocularity, color vision, depth perception, ensuring vision is not, there's not any anomalies in the vision. And then after that, if everything is good, every year thereafter.
And there was a study recently that talked about how increased screen time, people are always looking at laptops and devices now, and kids are doing that more and more often, and that the screen time is prematurely aging children's eyes. What is your advice on that?
Yeah, there's no doubt about that. Nowadays, when kids and adults, the average screen time is almost 8 hours per day. Some parents bring their kids in at the age of 8 and they're spending 8 hours on a screen time or an electronic device. There's a couple things to remember. Number one, make sure you have a proper visual correction. If you need glasses and or contact lenses, that they are being properly corrected. Number two, with the amount of blue light that's being emanating from the electronic devices, ensure that if you have glasses, you get the blue blocking technology that exists. Number three is to consciously blink more often. And this is something I'll tell a 60-year-old CEO of a company or a 6-year-old who's starting to use a tablet, that we often don't blink when we're engaged in visual tasks, which in turn dries our eyes out, irritates the eyes more. And then taking visual breaks. We call it the 20-20-20 rule. For every 20 minutes of screen time or engaged activity that we do, take 20 seconds to look at something far away, 20 feet away, to relax the eyes.
All right, good advice. And I'm sure that same advice applies to teenagers who look at devices more and more often. But let's talk about, a lot of them want to get into contact lenses. They don't want to wear glasses. So at what point should you introduce contacts to a teenager? Yeah,
it's always an exciting thing for kids to say they want to go into contact lenses. And the good thing is with technology that we have today, especially in the daily avenues, such as the Dailies Total One technology, we are able to fit a much wider patient range for contact lenses, and that includes kids. And because of the advancements in comfort, quality, health, and technology, we can fit kids at a much younger age as well. So I fit in my practice kids as young as 10 years old, providing that the parents think that they're responsible, because it is a medical device.
Oh, you got to take care of contact lenses.
Oh, we always remind kids that it is a medical device, and that if it's not used properly, that it can result in problems as well. Yeah. But that's why we always fit kids in dailies as a safety measure, because it's by far the best in technology.
Oh yeah, good to know. What about as we enter our middle-aged years? How do we care for our eyes in that sense?
Well, this is a fun age, because it's a kind of a reality check when we cross that 40-year-old mark. There's that condition called presbyopia, which is that loss of elasticity of our lens and our focusing ability. So results in a challenge to read. So of course there's always the reading glasses, progressives or bifocals. But nowadays, again, with some of the newest technology we have, and this Dailies Total One multifocal contact lens, we have an opportunity to fit patients in a contact lens that gives them reading vision, distance vision, and everything in between in a seamless process.
Okay, and we're almost out of time here, but just quickly, what about seniors? What should seniors be looking out for when it comes to eye health?
Well, 4 common conditions with seniors is cataracts, macular degeneration, leading cause of blindness, diabetes in the eye, and glaucoma, which is an asymptomatic disease. 1 in 3 adults above the age of 65 have one of those conditions. So check with your eye care provider on a regular basis. They should be seen annually.
I'll go to your eye doctor. Okay, good advice. Thank you for joining us this morning, Pavan. If you want to watch this segment again, go to our website, ctvmorninglive.ca.